those agricultural areas that are all across the U.S. We just pick some out that we know are agriculture heavy, but it's those that practice agriculture. So you're looking at Central Florida as a prime example. Those are agriculture heavy areas that then have those issues that spread out. But on the international, if you want to touch upon it.
Well, I'd like to assume myself as an imaginary diplomat, and so advocating for the African countries as well in such a debate, because I know for a fact that we often use pesticides in our countries in Africa, but one thing is that we do not know the effects that come along with using pesticides, especially on pregnant women. Again, as an imaginary diplomat, I had no idea about pesticides and the effects it has on pregnant women. So being able to understand this and having to relate this to my country does make a lot of sense, because we do not only have that as an issue, but we also have the big countries in the world that tend to dump some of those unwanted products in our countries in Africa, and that is detrimental to our health as well as pregnant women. Yeah. So yeah, I hope I've answered your question.
Yeah, you did, and I'll say, like Carlos said here, not imaginary, future diplomat. The one last thing I would leave everybody in the room with, great job in bringing these things to attention. They're hard subjects and sometimes hard for people to get their minds wrapped around it. So you got to find the sweet spot. Like for this maternal and child health presentation, your sweet spot and where you lean in to get a policymaker to hear what you're trying to say, the way you describe it, right? So when I talk about public health or maternal and child health, I do it in the name of national security, right? Because if mom and baby aren't okay, what's happening to the population? And life expectancy is going down for a variety of reasons. That makes people's ears open, right? So whatever policy you're talking about and who you're trying to impact, you guys got a heavy lift going after big ag folks over there. But they don't have people to work to build their technologies and to farm the land and things that affects their bottom line, right? So it's in their best interest to make sure that people aren't inadvertently getting sick and dying from their products. So that would just be my last thing. Figure out who your friendlies are, but then also figure out who would come out against you and mitigate those risks, if that makes sense.
I guess this is all the groups. I thought all your presentations were great. I guess, just moving forward, policy formulation and thinking about policies and how to execute them is really, really hard, right? It's complex. There's a lot of things to it, you touched upon it, stakeholders. There's the different costs, and I think a lot of those things. It's really important that when you're moving forward and you're starting to think about policy, to just get really specific on what your goal is, who you're targeting, because it just makes it easier to eventually formulate all that. So, because I know we mentioned I know when all you said costs, you were throwing out 100 million and 10 million. The first thing I think of is where are those numbers coming from, right? And it's just so hard to I had to take a whole class on it, cost benefit analysis, and had to figure out exactly where do those numbers come from, and that's way down the line of the policy formulation process. But just being specific in your initial approach, I think is probably the best takeaway I can give from it.
Then the GAO is going to make sure you're spending the money wisely once it does become
right.
right.
I don't even formulate the policy. We just look at it and audit it. So if you guys are formulating in the future, I might show up in your office just to make sure you're doing it right.
Well, everyone's presentation was great. I mean, I think you had how long to do it? 30 minutes?
A little under now.
Okay.
I don't know.
I would go back to I would give feedback in terms of specificity. I think that policy, you can think about it in this very large, grand scheme of your federal, your state, and your stakeholders, all these different components. But sometimes a very simple message, a very simple and specific policy can actually generate a lot of change. So when, giving a presentation, I think it's really important to keep that in mind. Also talk about the vulnerable population, since the whole thing here, right, if I'm not mistaken, is also like health equity, right? So talk about those populations, like how does it matter to national security for maternal and child health? Thinking about those kind of different intersections. But another thing, my background is public health law and more academic. So I will say, like, this is all a great teaching moment for, how the law is a social determinant for health, how it affects public health. So all of these changes that you're thinking of have an effect on health, as you'd like. And again, like, one of the most simplest things that we've been able to do, for example, is like seatbelts. Now that affects, car crashes and health through that. So what I'm trying to say is all of your presentations have been great. Think about it in terms of, not only these large ideas, but also how you can really simplify it to something that can affect different areas of need.
Thank you.
Yeah, I just wanted to check in. I know you've had a second day of fun and excitement. First off, another round of thanks to our panelists. Between Emily, a great example of one of our amazing alumni that are kicking butt here in DC in great circles. Andres, wonderful DC intern success story. Was your first internship with Congresswoman Wasserman Schultz?
Yeah.
There you go.
District office.
There you go, in her district office.
Hey, I was in her district.
Oh, really? It's
Hey. And since we're talking, and of course, Brittany with a very important organization, NGA, National Governors Association. One of her colleagues will be here at tomorrow's Global Health session. Maribel, do you happen to know Maribel's exact role?
Yeah, Maribel Ramos, she's our Legislative Director for Health and Human Services. So we work really closely together. She's on the federal side of things.
There you go. So she's officially lobbying on those issues on the Hill?
Well, we take our marching orders from the governors. But if they tell us to march, she's the one that goes to the Hill to march.
Okay. And this group, well, I first wanted to give a shout out to Congresswoman Wasserman Schultz and Congressman Jimenez, which the group met with this morning, since we're talking about health. Although we covered this year's current asks, both Congresswoman Wasserman Schultz in the fiscal year FY22 appropriations bill, and then Congressman Jimenez in FY23, the last cycle, were able to secure for FIU seed funding for what will be a PET cyclotron scan facility. Does anyone know what that might be? It relates to a PET scanner. We've all heard of PET scanners, right? With a added component and dimension of a cyclotron machine. In essence, let me see if I'm remembering this, because it's been 6 months since we've had to hit the same halls you were walking. It allows us to produce radioisotopes to be injected so that the PET scanner is and configuration is able to detect even more precise in the imaging. So it's the ultimate in imaging. There's only one facility like it in the state of Florida, and that's at the Mayo Clinic in Jacksonville. So this is the initial thrust. We still have to match, the university's gonna be matching with another $3 million. You all might see there's a new engineering building that's being built on the corner of 107th and Southwest State. That PET cyclotron scanner facility will be in that building. So, but the initial push came from Congresswoman Wasserman Schultz and Congressman Jimenez. Great bipartisan story, looking out for FIU. How did your advocacy visits go? I'm curious. And we still have a final one tomorrow, correct?
No,
Didn't happen?
come through yet.
So we had 3 today or 2?
Yeah, one that everyone went to,
Okay.
the caucus, and then one each.
So how did they go? Who can report to to FIU's official federal lobbyist how these visits went? I need to know. What was the first visit?
Was it him or was it his? Okay. Yeah, his staffer. We met with him. He was pretty receptive to everything.
Jimenez was the first, or?
Well, we split.
Okay.
That was an individual.
So who did you meet with?
Congressman Jimenez staff.
Okay.
Staffer, sorry. But,
Ray Anthony, proud of FIU alum.
Right.
Yeah. How did that go?
Pretty good. He was really receptive to everything we were saying. And like he didn't beat around the bush. Like for tiptoe around any of the topics we were talking about, he was really straightforward. So I really liked him.
Okay. Substantively, what was discussed on the issue of health, or what feedback did you get? And let's share. Go ahead.
Yeah, so we did bring up the 9/11 initiative that was presented on the screen. I'm blanking on the name. But we did bring that up and we talked about some of the logistics within that, and like we also asked them to write it down and like further think and look at it. And then another thing that came up was introducing help for caretakers and the elderly population.
Okay.
It was a really interesting conversation. We didn't expect it to go in.
He put that on the table, or you all put it?
No,
Yeah.
Well,
it was
he
like
introduced it to us,
segued.
Yeah.
Okay.
Yeah, he
Okay.
It was
introduced it to us.
related, but it was something that, well, he saw that it was related to what we were like talking about.
Yeah.
So he told us about that bill and we had a conversation about that.
Okay.
It was essentially like compensation for informal long-term care, which essentially means like the families who are taking care of like
Yeah.
elderly people. So that was really cool. And then we talked a little about
Whose families have, I hate to interrupt, experience in this? 'Cause this has become a long, I mean, this is our reality now.
Yeah.
Folks are living longer. You know, family structures are what they are. How is that funded? How is that spoken for? I don't think, you know.
No, so I think he was saying that like they were like proposing a bill or something.
Oh,
like
interesting, I
that.
did not know
Yeah.
that.
About like compensating the people essentially. Yeah.
Good.
So which was really awesome. And then we talked a little about public transportation. It was awesome. I think he was really kind of clear and he wasn't, you know, just kind of like running around what our questions were. And I kind of liked that he was like straight up and forward. He wasn't giving us like political answers, which I really appreciate.
Good, okay.
Overall,
yeah.
In relation to the World Trade Center health program, overall, he did say that he knew and that he was working with Congressman Jimenez and then someone that would informed him of the program.
Yeah.
And they are in support of it, and Jimenez is in support of it because of his background and his motives and attentiveness to
Yeah.
the.
And he mentioned his new bill, I would imagine,
Yes.
right?
Yeah.
Yeah. Okay, so that's Jimenez. Quick fun fact, it's not a health related one, but probably by Monday, so Monday's a big day for us. Monday's when we find out officially, and when they post officially, what the requests that they're actually like, you know, gonna grab like some football and attempt to put in play for us. We understand that Congressman Jimenez will be advancing one for the same engineering building, unrelated but more a computer science, AI incubator type facility. So I think he's asking for about $5 million or so for that. So these members do their part to do. Okay, next visit was?
Representative Mask's office.
How did that go? Can't wait to hear.
It was a lot of fun.
Break it down for me. I need details here.
So he went into his like what he did in the day-to-day life and everything
Okay.
first, and
The career
and then
stuff.
we went into the kind of environments and kind of what FIU's research does there, but especially like the Sargasso now and how they're looking at the different types of things
Okay.
and health policy. He was more or less very blunt in the fact that he doesn't know very much about health, even though he's the health policy advisor.
Oh, really?
Because
No
he
healthcare history or education.
he says the big thing he's working on right now is Medicare for us, and that's his
Yeah.
big priority concern.
Okay. Interesting.
Yeah, he talked to us about like the importance of networking and things like that. And that's how he got to his position. He said that when they were reviewing his, his position, they didn't really ask him about his education. They just asked him about his life experiences and volunteering, things like that.
Okay.